what we're seeing here is huge increases in the amount of technology that businesses are using, not just to interact and engage. We have some, not to push names, HelloDoc and these types of businesses in Indonesia, and there are numerous other ones in other countries that allow medicine to be delivered to your door, to facilitate online discussions with doctors, to be able to fix issues or get prescriptions for medicine that could take you hours and hours stuck in traffic to get, and has undoubtedly saved lives during the pandemic. So we're seeing large numbers of increase in the use of these types of technology. And we're actually seeing that physicians are forecasting more and more that more and more of their initial meetings, sometimes up to 25% of those over the next year or two, will be done virtually. Whether or not this is good, will things be missed that aren't done in person, or does it give more and more people access to good healthcare quickly? This is something that will be discussed today. What we're also seeing is travel restrictions. So countries like, especially Bangkok, that has a lot of medical tourism, Philippines, Indonesia is starting to grow this with the talks of new hospitals, etc., in Bali, to create a medical tourism industry. We've seen that slowed down. So those organizations have had to make shifts towards a much more data-driven approach. How can they engage their customers better, and how can they still attract business to keep those companies running? Well, these are all important points. And that takes us on to our next question. So how has your business adapted to the growing digital technology adoption in healthcare? So how has your business adopted to the growing digital technology adoption in healthcare? So I'll open this up to the panel. Who'd like to jump in first on that question?
I maybe would like to start the discussion. Yes. As our customer base is mainly healthcare professional, doctor, nurse. Yeah. So of course, with the way they work now is also changing, like what Anjie just mentioned before. Yeah. We also need to adapt with the customers' way of life. So the technology is coming. So we go with the new technology where we can interface with the doctor who now can work from everywhere, but they still can monitor with the patient, because most of the time patient and doctors they used to be interactive or deeply interactive, but now since they have some barriers, yeah. So this technology will provide more visibility so that they can access the what condition of the patient in everywhere. So this is something that I believe that it will be more and more technologies driven, yeah. And of course, from the industry like us, the company like us, we also need to be more digitalized, yeah. With the marketing digital, how we can support the doctors through the media, social media, or like a short video, or digitalize all information about the product and then share with them more easier. I think that's from my side.
Thanks, Djalu. Yeah, agreed. And I think what we see, and anybody who's seen healthcare professionals will know that you don't have a huge amount of time with those healthcare professionals as well. It's quite limited in terms of the amount of time they get to make those diagnoses and to prescribe something to you. And this use of technology, and especially AI, to be able to look at scans, to read scans and see things that rushed doctors may miss, I think has been something that I read about recently as well, which is really revolutionizing how we can prescribe medicine, how we can look at data, how we can look at scans and find the smallest of little details, that could be missed by the human eye. But fully agree with everything you said. Great points. Anybody else would like to come in on question number 2?
Sure. Okay, it means again. Okay, because of that, the situation changed. So from our company, we also changed the new ways of working, and it reflected a lot in our operation activities. For example, the technology and the digital, something we apply from in general, and I just told you we apply from the way we interact with the customer. So we interact with them in the past, like face-to-face. Now we use more the machine, more the AI card. We already identify with the channel should be the good for communication. So in the past we use a lot and multi-channel like SMS, right, emails or webinar. But now mainly we move and face-to-face, but now mainly we move more to virtual meeting is the first thing. And the second things after that, we also think that in the past, maybe one doctor, let's say, they can meet the med rep, they can meet the medical person and different information for them. And maybe they met the med rep from different company, like maybe MSD, AstraZeneca or Novartis, but in the end, and they maybe conflict time. But that's why the pharma industry, they already established a new app named Engage Connect. So in the next coming time, you can see that's a platform for a lot of pharma we join together. And then on that is a two-way. That means one-stop shop, like two-way for communication between the customer, in this case, like the healthcare providers, the doctors, and then the person from pharmaceutical company. So we can send different messages from different channel. We also can set up the meeting with them, and they again normally just one side, right? And now they also can set up the meeting from their side and send to us, send our people. They can receive that and can send the message and set up also the video call or the voice call together, and show up the schedule the one doctor, so no conflict in this case. And something like also consistency, the information between different functions in the company, for example, marketing, sales, and medical. So it's the one thing we change. The other thing we change here, we also impact to the R&D development, the new drugs and vaccine. So we use the technologies and we can have a faster the process to develop one new drugs and vaccine. You can see that's amazing or unbelievable, right? The vaccine COVID just take around 2 years, and we have nearly 2 years, and we have a new vaccine. And in the past, normally this process R&D takes 10 years to 15 years started from the lab to the market when you can buy the drugs. And now we reduce that gap, and we can use also the AI to predict. Let's have the next step and the result, the assumption, the result, use a different model. So that can help us to save a lot of costs and go faster to for the drug development and vaccine development. So it's also something like impact to us. And we also use more the electronic health app when we work with the hospital. So we also have the app just maybe focus on oncology, let's say the oncology treatment, and from that also for the antibacterial, the infectious disease. So the doctor have a more small source, and they can access different place versus install in the mobile, and they can access different, and also they can see maybe the antibacterial, the resistance is a platform in the hospital or in the different hospital in different country. So you can see that, oh, maybe this treatment pathway is not really right, and they suggest another treatment pathway is better and more adaptable and customized for the specific patient. So in this case, like we can see that is a more efficient and more proactive in the ways of working. Of course, besides of that, we also engage more compliant and legal and regulatory, because we also need to base on the local regulation, if any local regulation from the country, to protect the privacy of the person who they connect with the app, and also even the patient or the healthcare provider. So from ourselves, from my side, we can see that, and we moving more and more, use more the technology and the AI in the way we're working, and the face-to-face more to become virtual meeting, or we can hybrid. Yeah, thank you.
It sounds like you're going to have a degree in technology to work in the healthcare sector in the future. It sounds like you're using technology for absolutely everything, every day. It's fascinating.
Maybe we will be what we will do. What we will do next step.
Yeah, and that already talking about how blockchain technology can be integrated to look at tracking medicine, for medical records, for lots of different things within that space as well. So these really modern technologies potentially can be integrated as well. Yeah, very interesting. Thanks a lot for that, Anne.
If I may, James, if I may speak on the local scale, the Philippines probably holds the record for the longest and strictest lockdown in this whole pandemic, right? It's only March this year that we actually started to open up the economy. So that's a full 2 years. And that has forced the healthcare industry here in the country to become sort of experts already on, omni-channel and multi-channel engagement, in terms of webinars, remote detailing, use of apps like Viber, for instance. But there also still remains a challenge because majority of the doctors here, the physicians, still prefer face-to-face, right? But the companies were able to were agile enough to adjust between face-to-face and remote detailing, I think, are the ones who's going to succeed moving forward, not just here, but across the globe. In terms of global, talking about our global ambition, Sanofi aims to become a digital healthcare company. In fact, our chief digital officer just barely almost a week ago just announced a digital accelerator initiative. And in a nutshell, what this means is we're going to gather, in fact, we've gathered 75 digital experts already in our head office in Paris. And their aim is to come up with solutions and platforms based on digital data and artificial intelligence. And the objective is to ensure that there will be better outcomes for patients, right, moving forward. And the vision here is to reach up to 300 experts worldwide. So that's how serious our company is in terms of going through the digital revolution as we speak. I think this will also be good in terms of whatever, assuming the pandemic still, cases go up in other countries again, the company is going to be ready for that. And finally, we've already piloted about in 18 countries a CRM, digital app in terms of engaging with doctors. I'm pretty sure soon it's going to come over to our country as well. So really, I think the train has left the station, so to speak, and there's no way to go but digital, at least for our company, and I think in the healthcare industry in general as well.
Yeah, that's really interesting. Yeah, I think we've seen this, over the last kind of 5 or more years in the consumer sector as well. That move towards digitization of businesses, and more companies going online, e-commerce, and it seems to be now moving into other areas as well. So trialing, across 18 countries is a big project, very big. So, to see businesses going in that type of scale, talking to that number of experts is that, the train is very, very far away from the station, I would say. It's fantastic to see that amount of growth in a relatively short period of time for the healthcare sector. Seems to be moving much faster than it did in the consumer sector. Thank you very much for that, Ian. Anybody else like to jump in on questions?